Howdy doody. This is the first, let's call it an attempt to get you guys indoctrinated into the practice of marriage and family therapy. I'm going to run over a few things. This will be rather short. Most of the lecture is going to be a lot longer than this. But let's jump into this and kind of get an idea of exactly what we're going to be dealing with. And these are kind of like miniature nuts and bolts to begin with. This is not going to be some in-depth training program, at least in chapter 1, which is what we're dealing with. So let's kind of get the ball rolling, and we'll see how you react to this. Always be aware that some of the stuff you hear me say could appear on a quiz, but I'm not going to demand that you know every single word of these lectures. But you do need this asynchronous kind of experience to replace the normal in-class lecture. So away we go. You notice in your textbook, and I'm going to take most of my notes from there because this is kind of a double barrel thing. You get to read about it and you get to hear some comments from me about it. So we're talking about the first thing, scenario-wise, as being someone who comes into a therapist's office and he's complaining about things like the children don't really include him in stuff. They're doing things mostly with the mom and life things. So what am I to do? Where am I going wrong? So on and so forth. The therapist's approach in this scenario is one of individualism. In other words, a therapist who is working minus the input and influence of the family is going to address the client's symptoms and those alone. So they will notice things like depression, anger, etc., things that they attribute to the problems and contribute to the problems that this person is having. The lifestyle, whatever the case is, and you have to take into account you as a therapist are going to emotionally react to a point as to what your client is bringing to the table. And later on, we'll be talking about self-care. How do you manage your emotions? But for the moment, let's put that on the side and deal with our current situation. So I have a person that's come to me and they're saying, oh, wow, I just feel like I'm unimportant in my own home because all the important decisions are made by my wife because that's who my children go to. And that's what we're talking about here. We're talking about the nuclear family here. We're not talking about things outside of that realm. So you got to take into consideration the client's position. What is this person's life about? Do they have a lot of status? Do they have no status? What are their values? How much emphasis do they put on their values? Name the components of those values. You find in any kind of psychoanalysis, whether it be related to counseling or psychotherapy, you pick an area. You have to establish what I personally call honesty. I need you to tell me all about you. And in order to do that, we have to establish a relationship. You have to trust me, and I have to trust you. So, and this aids in the self-care. So that's our initial establishment. Now, we have different names for the parts that you're dealing with. Emotional reactions that the client expresses, and we call that the affect, A-F-F-E-C-T. And we also can refer to the client as a symptom bearer, although that's a little cumbersome. Client's a lot easier. So once we got all of these basic things that I've named so far, into our system, now we can begin to establish a place to work from. So how do we come about all this information? Well, origins and concepts, another area in your book I want you to be familiar with. Dealing with this kind of situational stuff prior to the 50s, families didn't really go as a group to a therapist. This was an individual thing. There's a lot of stigmatism attached to this. I don't want to go see a therapist because I appear to be weak, or whatever the negatives were. But that was fortunately changed. It's a fellow named Murray Bowen. You'll read about that guy. He noticed in his practice that when he treated an individual without any outside, what's a good word to use, inclusion, then the changes that may occur were short term. Sigmund Freud did the same thing. Sigmund Freud noticed that his initial attempts at psychotherapy brought about change in some cases, but it wasn't permanent. So in the case of Bowen, I'm not too sure that Freud was thinking this far ahead. He had other methods. But in the case of Bowen, excuse me, he started studying the relationships of patients who were in patients, as they were called then, in a hospital setting. And he found that unless some change in family interaction took place, that there was no change, lasting change in the individual. Hope this is making some sense to you. So another aspect of that, by the way, an offshoot of that was generational content. If you left surface traits related to family behavior untouched, then you didn't get a change in behavior, in emotion, and basically these traits passed on from generation to generation. So it's basically building upon itself. It's people like to say exponential, I suppose, and that's kind of what it is. So family therapy became a need. Bowen recognized that, hey, look, I can't just treat this person. I've got to treat the whole situation. So this is where the involvement of the family became recognized and needed, and now it's included in all family therapists, what's called family therapy. Group dynamics, small group dynamics, larger group dynamics, people who were involved in the discussion, the negotiation of items. These were all things that began to be incorporated into a family therapist practice. For instance, child guidance. If you look at it in the past, prior to this understanding of holistic involvement, if you want to call it that, we've had it treating only a child who had problems. Again, same as before with Bowen's discovery, it was discovered that there's no long-lasting change. So with family involvement, understanding the input of all the members of the family, then and changing those, then you begin to have success. One sidelight here, the child must come to an understanding that they're important, but they're not in charge. So you must establish, and it takes time, a child's understanding of that very fact. You can't continue to allow the child to be the conductor of all activities. I once heard a pediatrician. I was speaking with a parent, this many years ago, back in the 70s. I was speaking with a parent, and there was a pediatrician present, and she was concerned that her son's behaviors were confrontational. Tell him to do something, and he basically tells me to go fly a kite. You guys have heard the old stories. And the pediatrician's comment was, who's bigger, you or him? Meaning physically. But there's more to it than physical. I'm in charge. I'm the parent. And once he convinced that mom, he, not the psychologist, unfortunately, convinced the mother that, hey, take charge, take control. You're the mom. Accept your role. And later, a year or so down the road, this parent reported that, hey, once we had the understanding, it wasn't like I'm going to whack you upside your head. Conversations, not necessarily in the realm of a Spock conversation, Benjamin Spock, but an understanding that, hey, I am in charge. Benjamin Spock, you don't really see a lot about him. He, just to explain my reference to him, he was I think he was a pediatrician. I'm not sure. I know he was a medical doctor. But he decided that he should delve into the realm of childhood behavior. And he was one of the front runners in the creation of timeout. In my generation, the 60s, people really, toward the end of that, in the early 70s, began to really buy into that in place of corporal punishment. So I don't know if there's any tie-in to some of the problems we may be having now, but timeout doesn't work for all children. Actually, they think they've gotten away with things. I remember when I taught kindergarten that, yes, I did. That's why I have no hair. The kindergartners or the kindergartner teachers were given the strong recommendation that children should be placed in timeout. And Spock had even developed a formula for that. For every year of life, that's a minute in timeout. So if you're dealing with a 5-year-old and then they got in trouble, then they got 5 minutes of timeout. Children are very creative. So within 30 seconds, they've created some little entertaining thing for themselves, and for some, and it didn't work too well. So there had to be other means of punishment. No recess for you today, or whatever the case was. So I think you get the picture. There's a lot of involvement. There's a lot of movement around a child. There's a lot of input around a child. And it begins with a parent. So naturally, if you're going to do family therapy, hey, everybody needs to be involved. Hope you're following me along, okay? Book states Gregory, Bateson, Jackson, Haley, and Weakland, etc., who were studying schizophrenia. And it's really neat in science how things kind of evolve. I'm studying this, and all of a sudden I see a relationship in this, and it could be something totally disconnected from what I'm studying. But my work can work in that new area. In the case of schizophrenia, they determined that the schizophrenia successes in treatment, that is, may have been due to the fact that the person with schizophrenia really complied, not because they were being healed, but because they didn't want to cause distractions, or they wanted to maintain some sort of balance in the family. I think your textbook calls it homeostasis. Homeostasis obviously is a fancy word for balance, usually in the realm of pathology, but it works in the mental realm as well. So I want to kind of keep things on an even keel, but they still suffered from schizophrenia. They weren't healed. As a matter of fact, there's really no cure for this, but it can be controlled in some cases. So interactions with the family, excuse me, caused of the successes when these 4 researchers began to include family in the treatment plan were high. They thought that, look, if we involve the family and we work this together as a team, we should see some progress, that they did, and then they found that the schizophrenic symptoms lessened, of all things, minus medication. How wonderful that would be if you could heal this thing. Okay, about to wrap it up here. Family therapists, as far as their approach, would be a circular approach. I'll get into that in a minute. I want you to understand how this Bowen family system works, and then this circle rather than linear explanation I want you to be aware of will make better sense for you. So in the case of Bowen, his approach would be as having an understanding that the family involvement, and this Murray Bowman guy was brilliant, by the way, would be conducive to long period. Let me back up. It would be effective over a long period of therapeutic work. Hope that makes sense. Contrast that with a cognitive behavioral family therapist who would not necessarily be dealing in family inclusion, would rather be worried more in terms of the client's disruption emotionally in the client alone. And then we have things called strategic family therapists. And their idea would be to instruct the client and maybe the spouse, hey, do certain behaviors behind closed doors. So all of those lead to exclusion, and that's not what family therapy is all about. By the way, when you hear these things, send me an email if you need further explanation. I'll be glad to accommodate you. So, using models, that's basically what we just talked about. The use of the models that you choose. And we harp on Bowen because he was such an influence in this area. And down to and back to the circular as opposed to the linear approach. If you think about reality, if you think about the reality of a family situation, then regardless of whether it's good or bad, it still functions in what we call a circular design. It's made up of occurrences. It's made up of input from all members. And it's made up sometimes of misunderstanding. So it's not all positive. It's both. It's negative and positive. We look, unfortunately, only in the short term. The book uses a good example where a mother yells at her 13-year-old daughter because the daughter was supposed to clean her room and she didn't clean it. So that's a narrow focus. It turns out in this example that the daughter did not clean her room, but she did clean the living room. So if you apply that almost in terms of operational conditioning, then you find out that the praise factor that could have been involved in this didn't exist, and therefore you wind up with a negative situation. And consequently, the daughter is upset, the mother is upset because she was angry, yelled at the daughter, called her lazy, resentful, blah, blah, blah. Could have long-term effects too, by the way, of course. That's pretty obvious. Yelling about other things. Now that she's established the fact that the daughter's lazy because she didn't clean her room, didn't look at the living room. I mean, these are simplistic kind of things, but guess what? It's reality. It happens. I'm sure that you've probably been in situations similar to that yourself. So what would a family therapist do with a situation like that? Identify the fact to the people involved, the family, and particularly the client, that this is a circular situation. And what you want to establish for the family is what's known in the physical realm as homeostasis, which means a physical natural balance. It works for mental too. So I want you to have the understanding that establishment of homeostasis is really basically what we're looking for. We're looking for healing, but that comes from homeostasis. Your body works that way. It tries to establish homeostatic existence. That's why you get a runny nose, get a headache, get a fever, etc. It's your body trying to correct things. Sometimes it needs some help, and that's what's called medicine. What else do we do? We look for patterns, communication patterns, matching behaviors, anything that we can draw on to make things point toward homeostasis. There are a lot of systems in your world that work that way. What I'd like you to do, and I'm going to wrap this up now, I'd like for you to read a little bit about cybernetics. I'll say it again tomorrow and it'll sound right. I'd like you to look at morphostasis and morphogenesis and how families mechanically process their lives. Some of that's common sense. Metacommunication, another area I'd like you to be very familiar with. And then toward the end of that section, genograms, and then record keeping. My gosh, you better be good at record keeping and documentation. So look over these items in Chapter 1. And I'll be back with you potentially again this week, most likely next week. And the next lecture will be more about what's in Chapter 2 and maybe even Chapter 3. Okay, so enjoy. Thanks for bearing with me. We always kind of get started on a shaky note in some cases when we make big changes at the university, but I think it's all good. Have a good one.